everyone, I'm Maddie Seid, and this is my special test video project. The first test I will be demonstrating is the Kendall Test. As you can see, the patient is supine with their legs off the table. The procedure for this test is to ask them to bring one knee to their chest and hold it. A positive test would be if the hanging knee extends. The next test I will be showing you guys is the Thomas test. For this test, the patient is supine. To perform this test, you're going to ask the patient to grasp their knees, and as you slowly lower one of their legs, you're going to do this on both sides. A positive test could be indicated by an inability to do this or pain as they're performing the action. The next test I'll be showing you guys is the Elis Test. For this test, the patient will be lying sideline on their unaffected side. To perform it, flex their leg at their knee to 90 degrees. Then you're going to stabilize the pelvis and keep your hand under their knee. Then you're going to lift their leg and anchor it as shown. And then you're going to slowly let it drop. A positive test would be an inability to self-lower or pain while doing it. The next test I'll be demonstrating is Renees Test. For this test, the patient will be standing with their feet shoulder width apart. To perform it, have them stand on their affected leg, and then you're going to kneel beside them. And then you're going to place your thumb over their lateral femoral epicondyle, and then you're going to have them squat to 30 to 40 degrees of flexion. A positive test would be pain. Next up is the Trendelenburg Test. So for this, you're going to have your patient standing, and to perform it, you're going to have them stand on one leg for 10 seconds. A positive test could be indicated by a drop in their pelvis on the side with their leg up. Elis Test. For this test, your patient will be prone. To perform it, you're going to stabilize their pelvis, you're going to grasp their foot and flex it. You're going to do this on the opposite side as well, however, you do not need to switch sides. A positive test could be indicated by the hip spontaneously flexing with knee flexion. Nobel's Test. For this test, your patient will be supine with their knees flexed to 90 degrees. To perform it, you're going to apply pressure to the lateral epicondyle, and then you're going to grasp the ankle and extend the leg. A positive test would be around 30 degrees of flexion. They'll complain of a severe pain over the lateral epicondyle. Piriformis Test. For this test, the patient will be side-lying. You're going to flex their hip to about 60 degrees. You're going to stabilize their lateral aspect of their pelvis, and you're going to put your other hand over their knee. You're going to apply a downward pressure to this knee, and then a positive test will be pain over the hip. The next test we have is anatomical discrepancy. For this test, your patient will be supine. You will need a tape measure. I use a sewing tape measure. And so for this one, you're going to measure from the medial malleoli and anterior superior iliac spine. And you're going to repeat this on the other side. A positive test would be a notable difference. The functional discrepancy test is very similar to the anatomical discrepancy test. However, you'll be measuring from the umbilicus to the medial malleoli, as well as repeating on both sides, and then a positive test would be a notable difference between these two measurements. Gait test. For this test, your patient will be supine. You're going to ask them to bring their legs to their chest. You're going to slowly lower their leg off the table and then apply pressure at their knee into extension, and then a positive test would be if hyperextension causes an increased pain. The final test that I'll be showing you guys is the Patrick or Faber test. For this test, your patient is supine. You're going to put them into a figure 4-like position. You're going to put your hand at their ankle and knee. You're going to push down on the knee, and then you're going to do this on the other side as well. A positive test would be if hyperextension increases their pain. To everyone who got this far in my video, thank you so much for watching it all the way through. I know I liked making this project, and I hope you liked watching it too.